is Dr. Sima Dutta Roy, Consultant Physicians, AMRI Salt Lake Hospital. I am going to speak a few words about dengue. Now, kill the mosquitoes before they kill you. This slogan seems to be the most important one while we are trying to create awareness about dengue. Now, dengue is one of the most serious and major public health problems in India. And as we all know, dengue is caused by a mosquito. It's a mosquito-borne viral illness. The vector in question is Aedes aegypti mosquito, which usually bites in the daytime. So we should all wear full-sleeved clothes, use mosquito nets, mosquito repellents, and try to prevent accumulation of water in the vicinity of households. Now, speaking a few words about dengue, the disease itself. Now, what are the most important symptoms of dengue? Usually, the patient will present with high fever, body ache, headache, backache, and retroorbital pain. That means pain behind the eyes, along with other constitutional symptoms like nausea, vomiting, pain abdomen, etc. Now, while these are the symptoms of classical dengue, what we need to be more cautious about are the features of severe dengue. Now, what are they? Bleeding manifestations. That is, bleeding from either the gums or the nose or the mouth or any other site. Or there may be petechial hemorrhages or hemorrhagic spots in the skin. Secondly, vomiting, profuse vomiting, severe abdominal pain, listlessness or severe weakness or lethargy, restlessness, breathlessness, cold clammy extremities, and fall in blood pressure. Now, if these symptoms are present, then the patient, that particular individual, needs to be rushed to the hospital and requires to be admitted immediately. Now, how do we diagnose dengue? Usually in the first 4 or 5 days of the illness, the antigen or dengue NS1 antigen is tested. After 4 to 5 days, we usually test the antibodies, that is dengue IgM and IgG. Along with it, we do a few relevant tests, particularly the complete blood count. The WBC count is usually low, and platelet count. Now, a few words about this platelet count, because there is usually a sense of unnecessary panic regarding this platelet count. Usually, a platelet count below 1 lakh per cubic millimeter is known as a low platelet count or thrombocytopenia. But in dengue, if there are no bleeding manifestations, there is no need of platelet transfusion till the platelet count drops to a level of 10,000 per cubic millimeter. So this sense of unnecessary panic regarding this platelet count should not be there. Second is hemoglobin and another parameter which we call PCV or packed cell volume. If there is a rise of PCV or the hematocrit more than 20% above the baseline value, then that is a bad sign and the patient should be admitted in the hospital and given intravenous fluids. Now, coming to the treatment part. Usually we give symptomatic treatment, that is paracetamol should be given for control of fever and pain, including headache, body ache, whatever, and other symptomatic medicines. For example, medicines for vomiting, medicines for abdominal pain, etc. And fluids in plenty. In case of severe dengue, when we admit the patient usually receives intravenous fluids, and the intravenous fluids are usually guided by clinical parameters like blood pressure, urine output, as well as this particular PCV and hemoglobin level, which we need to do on a daily basis, along with platelet count, which we also need to do on a daily basis. Now, another thing is there is no definite antiviral treatment available for dengue. Antibiotics are not to be given unless there is any evidence of secondary infection, and other type of painkillers like aspirin, ibuprofen, diclofenac, they should all be avoided. So it is usually paracetamol, other symptomatic treatment for the particular symptoms that we have, and fluids in plenty. And a lot of research work is going on for development of an effective vaccine, and we are all looking forward to the discovery of such a vaccine in the near future. Thank you.